Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast.
KSJE is proud to be awarded first place in Best Larger Market Social Media Integration by the New Mexico Broadcasters Association. Learn what's happening in your community. Join Scott Michlin weekday mornings at 8 for local stories, local vibes. On air, on demand, or online at ksje.com. Better yet, watch the visual radio program on Facebook or YouTube. Community supported, award-winning KSJE. Farmington, New Mexico.
Ten minutes past 8 o'clock. It is Wednesday morning, the 10th day of June, 2026. Good morning, everybody. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM right here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on planet Earth, you've gone to our website to tune in. That's ksje.com, or maybe you're listening through the KSJE radio app, or you've asked your smart speaker to play KSJE. Glad that you are with us this morning. Also want to welcome the folks who are watching me right now, because the video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So glad that you're all with us today, because coming up, my guest from San Juan Regional Medical Center will be talking in the next few moments about pelvic floor therapy and pelvic floor health. So stay tuned for that coming up in the next few moments right here on KSJE this morning. Then, of course, next hour, it's our classical music program, Roving with the Arts with Mick Hess, a special 90-minute version today on Wednesday, of course. It'll take us to 10:30. And right on Four Corners, our local and regional author program with Delcherie Spinner. This week, Delcherie is talking with author K.S. Wirtz. She's going to have a author talk this week in Farmington. She'll be explaining kind of how her process goes for writing. You'll learn more about that coming up today at 10:30 on KSJE. Also want to remind you, KSJE has gone on the road once again. We were just at Greece last night for one of the final rehearsals. That is the outdoor summer theater offering this summer at Lions Wilderness Park Amphitheater. You can watch that show anytime now. It's on YouTube and our Facebook page, so check it out. And coming up on Friday morning, we're going to be out at the San Juan River Balloon Rally, bright and early. We will be crossing our fingers. The balloons will fly, and we'll provide live coverage of that mass ascension around 7 a.m. this Friday morning from the San Juan River Balloon Rally, part of KSJE on the road. You can also connect with us on other forms of social media like Instagram or Blue Sky or X. And if you're a podcast listener, you can subscribe to KSJE Podcasts. We publish new ones every day. You'll find them wherever you listen to podcasts. So check it out and maybe discover a new local program that you may have missed. Even better, you can certainly download and get the KSJE Radio app, available at the App Store and on Google Play. Podcasts are right there. Listen live and much, much more. Outside our studios at San Juan College this morning, it is sunny and 65 degrees at the moment. We're expecting a sunny day, 89 for a high in Farmington, 63 overnight. Tomorrow, sunshine again, 86 on Thursday, sunny and warmer on Friday with a high reaching 90 degrees. It'll be sunny and 88 on Saturday and Sunday, and overnight lows, as you can see, mostly in the 60s. Back with my guests with more right after this on KSJE. In a medical emergency, stroke, heart attack, trauma, every minute matters. The decisions made in those first moments can change everything. San Juan Regional Medical Center offers advanced, comprehensive, definitive care. Available 24 hours a day for everyone in our community. When minutes matter, San Juan Regional Medical Center is here. Find out more at sanjuanregional.com. Looking for a new opportunity? Gore Energy is hosting a job fair on Wednesday, June 10th from 9 a.m. to 4 p.m. at the Comfort Inn and Suites in Aztec. Gore Energy is hiring Class A CDL drivers, hydraulic fracturing equipment operators, and nitrogen equipment operators. If you're looking for competitive pay, strong benefits, and the opportunity to join a growing team, Gore Energy wants to meet you. The Gore Energy Job Fair, June 10th in Aztec. Visit goreenergy.com.
Now back to Studio A and the award-winning Scott Michlin morning program on KSJE.
And back in the studio with me this morning, as I mentioned, my guest from San Juan Regional Medical Center. We're talking about pelvic floor therapy. Amy Link is here with us this morning. She is one of the pelvic floor therapists at San Juan Regional Medical Center, physical therapist. Good morning. Thank you for being here.
Thank you.
Appreciate you coming in. Yeah. You bet. Also joining us this morning, one of your colleagues, Bria Rubie, is here this morning as well. Bria, good morning to you, and thank you for coming in.
Good morning. Thank you.
Appreciate you both being here this morning to talk about this really important topic for mostly women, but men can also deal with this as well, and children too. You mostly deal with women at San Juan Regional Medical Center, and so let's start by talking a little bit about what pelvic floor is and why we need to be aware of it, and I guess why we need to watch how it is in our bodies and things like that. So who would like to start there?
I'll start with that.
All right. Very good. Thank you.
So pelvic floor therapy is the treatment and evaluation of the pelvic floor muscles. So Bria and I, as pelvic floor therapists, our job is to figure out why the pelvic floor muscles aren't working the way they should, and give exercises and treatments to help get things working the way they should. And the pelvic floor muscles are a sling of muscles on the bottom of our pelvis that go from our pubic bone back to our tailbone. So they provide support to our organs. They also help keep us continent, so we're not peeing and pooping ourselves. And then they also work alongside with our core and our hip muscles to help provide support to our back and our hips and all that. So they're very important, and usually when they're working the way they should, they're very automatic. So they're just doing their job while we're not having to think about it.
Right. Okay.
But then people might start noticing some symptoms where they are usually bothersome symptoms that are causing some trouble that are indicating that the pelvic floor muscles aren't working the way they should be. So some common symptoms are, did you want to mention them, or? Yeah.
We could. Yeah. Very good. What can cause some of these issues, right?
So some of the symptoms that you should look out for if you think you might have pelvic floor dysfunction, we've got bladder and bowel incontinence, which she mentioned, also pelvic organ prolapse, pelvic pain, or even urinary frequency or urgency. So some of those symptoms might look like, especially for urgency or frequency, is having to pee more than every 2 to 4 hours. So if you're peeing every hour, that's too often.
Right.
So we help treat that. Urinary incontinence, so any leaking with coughing, sneezing, laughing, jumping, running, or even just with the urge to go to the bathroom. We have some folks that leak urine with that. Bowel incontinence, so leaking stool when you are also doing any of those activities, coughing, sneezing, laughing, that can also happen. And then pelvic organ prolapse is where people feel pressure at the bottom of their pelvis. So they can feel something kind of like coming out, or feel like they just don't have as much control. And then pelvic pain, we often see that with activities like sitting, sexual activity, or even like getting to your regular activities like running or jumping.
Got you. So you're right. A lot of those issues that people would pay attention to, I imagine, and just wonder maybe what's going on. And maybe some folks have a hard time identifying that it's a pelvic floor maybe issue when they think it could be related to something else, I suppose. And so that's why you two are doing the work that you do. And so when that happens, and I guess these issues be caused by something else, or what usually kind of leads up to some of these issues that folks find?
Yeah, so there can be many different causes for pelvic floor dysfunction. One of the most common ones is pregnancy and childbirth. Right. So that's something that a lot of women deal with. But that doesn't have to be the cause. And so, but that's a big one, is being pregnant, 9 to 10 months, and then having that pressure on the pelvis and the pelvic floor muscles can cause weakness and some issues. And also during the birth process, there might be some tearing and that sort of stuff where, a big old babies coming out of these small areas, so that can cause
things are stretching and tightening and moving and all these things, right?
Exactly, and a lot of people can heal from that point, but some people might notice some residual stuff that's not resolving, either pain or leaking or prolapse, like Bria said.
Right.
Another Another common thing that can cause it is menopause. So a lot of women might notice some changes whenever they start going through perimenopause and menopause. They might start noticing that they're having to go pee all the time. They have less control over their bladder, and or something like that, where
Right.
it's like things just aren't working as well as they should, like it used to. And so we work with a lot of women with going through peri and postmenopause,
Got it.
those sorts of symptoms. And what else? So, also younger women can experience. And older women, all women can experience pelvic pain, potentially with their menstrual cycle. So if they're having a lot of cramping, a lot of pain around their menstrual cycle, and maybe even outside of their menstrual cycle, then that's an indication that there could be stuff going on. It's good to get checked out by your OBGYN, but then there could also be something going on with the pelvic floor muscles where they're not relaxing as well as they should, and so they should definitely come see us.
Okay, very good. And so when they do come see you, you are looking at kind of what the issues are, what the possible causes could be, and things like that. And then there's also the treatment, of course, and the physical therapy that you both do. And so talk to me a little bit about that, because you mentioned earlier that these muscles are kind of hard to get to. They're not really, noticeable, I guess would be another term, or things like that. But there's probably some things that folks can do and things that you do to help these patients. And so is it a challenge, or is it somewhat unique in some of the treatments that you have for this condition?
Sure. Well, it can be a challenge for some people. This is an area of our bodies that are, they're vulnerable.
Right.
It's not like they're really wanting to, have that area, especially if it's not working right. It's even more just like, I don't know what's going on. It could be uncomfortable.
Right. Well, and as you said, when it's working, it's kind of automatic. So it's not like our arm that we know we're going to move our arm and things like that. And if something's wrong with it, we can keep trying to get it back to the way it was. But if it's kind of automatic, I don't know what I would do to try to get back to that automatic activity.
Yes. And so that's our goal. So we do, we'll do a pelvic floor assessment if the person coming to see us is comfortable with that, which is just a gloved, lubricated finger gently inserted into the vagina. We can also do, what we're doing is we're assessing the muscles to see what they're doing. Because a lot of times, and I notice this with a lot of my patients, is that it's not always a strength issue. It's just that the muscles are working at the wrong time. They're doing the wrong thing at the wrong time. The muscles are supposed to tighten at a certain time, and they're supposed to relax at a certain time. And so
something about that automatic function has gotten broken or whatever.
Exactly. It's doing the wrong thing. So we do a ton of breath work, and because our breathing is so connected to our pelvic floor muscles, so everyone gets, and I'm sure Bria is doing the same thing, is like everyone gets a breathing exercise. We're doing a lot of breathing with the exercises we give that might be more core and hip strengthening exercises. Sure. In order, because we want to reteach that pelvic floor when it's supposed to contract and when it's supposed to relax. And and then that helps. Eventually it takes a lot of thought where you're having to think about it a lot, but eventually the more you do it, the more automatic it becomes.
I see. Interesting. And so I guess would that term muscle memory come into play with some of these things that you're trying to maybe either reteach these pelvic floor muscles that have forgotten or something has happened, and so to get them back into that memory, I suppose, to do what they're supposed to do automatically?
Exactly.
Yep. And that goes into I think the Kegels is where a lot of times we're just told to do Kegels. Our doctors might tell us that, or grandmas might be telling us to do that. So it's like we're doing Kegels all the time thinking it's causing the problem. And Kegels can be helpful, but we're not doing it in a way, it's not helping getting the automatic function back on. So Kegels might be a part of our treatment plan, but it's usually a very small part of it. And so we are doing lots of other stuff to retrain those muscles and get that muscle memory back online.
Got it. So if someone is maybe suffering from this or noticing this and doing those Kegels, but it's not helping, that could be the reason why, because maybe there's more that needs to be done.
100%.
Got you. Okay. Very good. And Bria, with your treatments as well, I mean, how much, as the core is kind of all working together, I guess, is that something that you have to look at too, from diaphragm on down, I suppose, if not lot more.
Yes, exactly. So we're looking at that breath pattern where it starts in the chest, but we should also be getting some lengthening and movement in the lower ribs down into the belly. So that automatic breath where we try and take a deep belly breath in actually helps relax the pelvic floor. And we need that relaxation in order to have that strength for that Kegel. So we often start off with that breath work that she mentioned, that we need to relax the pelvic floor, breathe in deeply, let everything go down, so that we then have the control to lift everything back up. So we utilize that for helping folks re-coordinate that, because often it's easier to think about and see your breath moving more than your pelvic floor, because I can't tell if you're doing a Kegel.
Right, right.
When that's happening, right? But I can see if we get some lengthening and movement in the belly or in the rib cage. So we definitely focus in on that to start with. And then depending on folks' level of symptoms, if that's leaking with everything they're doing, or maybe with higher level activity, we'll then progress their exercises to help them get back into that. So for some folks, it's just going from sitting to standing that we need to help them out with. For other folks, it's that like jumping and running. So we're helping work on that progression of that natural coordination.
I see. And for some of your patients, are they surprised to learn that maybe there's treatment for this issue? If they just thought, well, I'm just getting older and things are changing, it is what it is. Are they surprised to know that, no, it doesn't have to be that way? It's not a permanent maybe condition, and there is treatment for this issue that's bothering you?
Yes. Most folks are very surprised.
Right.
Even if they know that, I should not be leaking urine, they're also surprised that maybe some of their symptoms of like constipation or abdominal pain or even hip pain or back pain could be associated with the pelvic floor as well. So often we're looking at those primary symptoms that I mentioned before, but then we're going a little bit deeper into like history of that back pain, hip pain. We'll also assess knee if folks are having issues with their knee. We'll also look at that. And then also the ankle. So I have some folks that I'm working on ankle mobility and strength with. And Amy does some more assessments and has taken some courses more specifically on that. So if you want to mention some of that.
Sure. How are the knees and ankles connected to pelvic floor? Help me understand the connection there.
Yeah, well, it's all connected. So,
right. Our bodies are connected.
Exactly. And so even it usually starts up, I think, can start a lot in the hips. So weakness in the glutes and the hip, they're kind of our big workhorse kind of powerhouse muscles for our pelvis to help keep things stable. So if there's a lot of glute weakness, there's going to be issues. The pelvic floor has more strain on it and more demand.
Okay.
And so we want to get those glutes nice and strong, but then that also affects down in the knees. So if the, these knees, if there's weakness up in the hip, it causes issues down in the knees
and ankles,
and then down into the foot and ankle.
Right, okay.
And so also a lot of times you might have heard of pronation with the foot. That's where the foot collapses down in. That causes more strain on our inner thigh. I wish I had a picture of it.
I know you have models and things like that in your office, right? Exactly.
I know exactly, but when our feet are collapsing inward, our hip adductors, our inner thigh muscles, are more lengthened, which then affects our pelvic floor muscles because it's fascially connected up into the pelvic floor.
Okay.
So
I follow that. Sure.
Yeah,
sure.
yeah. So having that. We want a nice muscle balance. We don't want anything too lengthened, and we don't want anything too shortened. So we're trying to find a balance in the muscles. That's kind of our goal.
Makes sense. Yeah. Sure. Exactly. And you mentioned core, of course, and I think a lot of folks who exercise know how important that is, and anyone with back issues know how important something unrelated maybe to your back can cause back issues and things like that. And so this all is connected, and so it makes sense to me. I was wondering about weight loss or weight gain. Is that also something that could affect pelvic floor and things like this?
Yes, I think it does. I think my personal opinion is that it can contribute to increased pelvic floor issues like leaking and all that, but I think it is a little over done. Like a lot of my patients are like, my doctor told me if I just lose weight, it'll go away, but I've lost weight, I'm still having the problem, so I think it can contribute, but I usually find you can, even if you're still have a little excess weight on you, you can get your pelvic floor working great. So I find it's a little
Yeah. I like to
it shouldn't be a non-starter, I guess, to have that conversation. Okay.
Yeah, absolutely. I like to think about it that the that we're trying to help the pelvic floor and the rest of the muscles of the body try and meet the demand of what we need to do in the body. If you have experience like weight gain and more urinary incontinence, if we work on some strengthening and some breath work and some like control of the pressure in our abdomen, that can help with the pelvic floor. So we can help the pelvic floor meet the demand of the body.
I see.
So with weight loss, I haven't seen anyone with weight loss complain of increased symptoms. But if we're considering losing weight and that's muscle mass, then I could see how that might affect just strength of those muscles, but that's not something I've seen as regularly.
Understood. Well, and again, we're hearing all about these GLP-1s and things like that, and so maybe the weight loss is happening faster than it used to, and so maybe that would kind of shock the muscles into saying, oh, we're not holding up all this stuff anymore. Maybe it's not there anymore, and maybe that would be something that would affect how things work or are supposed to work.
Yeah.
I'm not a doctor. I didn't even play one on TV, but I'm just saying, right?
Yeah, it'll be interesting to see what research comes out.
I'm sure it's very new, so maybe there's a lot of folks that are looking into that, and so seeing what that does. But with the work that you both do at San Juan Regional as pelvic floor physical therapists, you work mostly with women, as we said, this condition that can affect men and also children, and you're looking at starting some work with children as well, but mostly women for right now. Isn't that kind of the current status?
Yep, we're mostly working with women right now. San Juan Regional used to have a therapist who did do work with men. Men do have pelvic floors, and there are some guys out there that do need some pelvic floor therapy. We're at this time not offering that,
Sure.
and then but it might be something in the future.
But something for men who are listening to maybe be aware of that they could have an issue, and don't be afraid to talk about it.
Exactly, it can absolutely affect men.
Okay.
And then we're in the process right now because San Juan Regional, at our pediatric clinic, we're in the process of building a pediatric pelvic health program. And so some of our pediatric therapists, they're going through some training right now. And so hopefully that will be in effect by the fall. Kids can, pelvic floor therapy looks different for kids than it does for like what we see in adults.
Right.
Mostly in kids, it might be like school-aged children, right, who are having bedwetting. Constipation's a huge one.
Right.
So some kids can just have such a bad problem with that, and so the pelvic floor therapist can help help kids figure out how to get their pelvic floors working a little better, and also help guide families on how to manage that.
Gotcha. Very good. Well, this is important, I think, for folks to realize kind of what this might be, and maybe for a mom or dad who's listening this morning and wondering, what the problem is, maybe no one's mentioned that to them. You would hope that a pediatrician would, and I imagine that they would probably try to look into that, but it might be something worth mentioning at the next doctor's visit or something like that about pelvic floor and children, boys and girls, as to what this might be. So that's important to know. With the work that you both do with women, is there a certain length of time that these patients are in your care, or does it depend on the patient? I imagine it depends on the conditions and things like that, but is there an average about how long they spend with you in getting this therapy?
Yeah, it definitely depends.
Okay.
But often...
It's not a one-size-fits-all, I understand.
Exactly. So often I would like to see patients one time a week for at least 6 to 12 weeks, depending on what they're experiencing. And then also depending on how much time insurance allows them to come into PT, because we do take insurance. So yeah, one time a week for about 6 to 12 weeks. And so in that time, we are going to focus on kind of that regaining that control, that motor control of those muscles, and then work on building some strength after that. So often strengthening can take about 6 to 8 weeks, and so that can take some time. A lot of times we're giving, not a lot of times, every time we're giving folks homework. Okay?
Right. I was going to ask you about that. Sure. There's work that the patient has to do on their side of things, right?
Exactly. So that one time a week is really where we reassess how you're doing, start working on some new things, provide some treatments, maybe some manual therapy to the abdomen or the pelvic floor, to the low back, and then send you home with how you can kind of maintain that progress that we made in that visit. So that can be some stretches. A lot of folks are familiar with some of the yoga poses like cat-cow and child's pose. So that's a really common pelvic floor stretching activity, and then we'll add some strengthening on top of that. So you'll work on that at home, hopefully a couple times a week, and then come back in for your next visit, and then we'll progress things from there.
Got you. And so, and that can take, I mean, a couple months or a few months, it sounds like to me. So that sounds like a good plan. And then again, from there, is there then, if folks go home and then they still have an issue or they come back, I mean, or is this usually once it's fixed, the muscles remember and it's automatic, and that all starts up again once they follow through with the treatment?
Yeah, that's a good question. We see a little bit of variability in that. Sometimes people do need to come back if something happens, like if they get sick, if folks get like COVID or bronchitis and they start coughing a lot, that can put tons of pressure on the pelvic floor.
Right.
So they may need to come back and visit us if there's been a big change in their life. Or, you know, if we see them postpartum and then they eventually go through menopause, and maybe we'll see you 15 years later, something like that. But for the most part, folks, when they take home this exercise program, you can do all of this for life. So, you know, maybe start off with the stretches, get the strengthening in, and then if things are getting worse again, maybe go back to the stretches and then build back up to the strengthening. So we kind of give you some tools to help manage things going forward.
Got you. Very good. Well, that's important to know as well. And so for folks who are listening this morning, I mean, would they need a referral to come and see you from their doctor? Is that kind of how it would work for most insurance and things like that?
Yes. Yes. If you want to come see us, go to your doctor. It could be your primary care. It could be your urologist. It could be your OBGYN. And just ask them for a referral to come see us. And then, they'll get you scheduled, and we'll be happy to see you.
Okay, start the process, I guess, and kind of see what is going on, and be able to come up with some treatments and things like that. So that's really, really, really important. So very good. Well, any final thoughts before we run out of time here? We're in our final minutes this morning. So any final thoughts for folks who are joining us and listening about pelvic floor health and what folks should be aware of?
I think one thing, and I think I started to say it earlier, but I got distracted.
You.
No, it's okay.
You.
I was going to say, if you are a little worried about coming and seeing us because you're worried about the internal pelvic floor exam, we don't have to do it. So I do want to say that. It does help us get an idea of what's going on with the muscles, but there's so much we can do without
doing
it.
that.
Yeah, so we're never going to pressure you.
Got it.
Yeah.
That's optional. So good to know. Very good. Bria, anything else to add today?
If you are just unsure if you have a pelvic floor condition, get a referral, come see us. We'd be happy to take a look and see what we can do for you. Because like I said, we treat everything kind of through the whole body. So we're just looking at anything we can help out with functionally.
Very good. Okay. Excellent. Well, thank you both for coming in. Great talking with you. Great information to share. I appreciate it very much.
Thank you for
so much for having us.
You're very welcome. Thank you both.
Thank you.
My guest this morning from San Juan Regional Medical Center here with me on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.